Let's talk about sickle cell anemia. What is sickle cell anemia? Sickle cell anemia is an inherited condition and is therefore neither infectious nor contagious. So, what causes sickle cell anemia? Sickle cell anemia is caused by an inherited disorder of the hemoglobin structure. So, hemoglobin is a protein that is contained in the red blood cells in the blood. It picks up oxygen from the air in the lungs and carries it to the other parts of the body where it is needed. So, I want to tell you that the normal red blood cells have a round pebble shape. However, the sickle cell anemia, the red cell changes from round pebble shape to a rigid cycle shape when it gives up the oxygen it is carrying. So this shape makes the red blood cells block the small blood vessels, causing severe pain and death of the surrounding tissues. The sickle cell or the cycle shape red cell dies sooner than normal shape cells. A normal red blood cell stays in the circulation for 120 days. Red blood cells in patients with sickle cell anemia stay in circulation for only 20 to 40 days without enough red cells. The individual will not have enough hemoglobin. Someone who does not have enough hemoglobin is anemic. People with sickle cell anemia are prone to chronic anemic. When we say chronic anemic, this is a long-term disease that is in you. So it is a long-term anemia. We have types of hemoglobin. We inherit the type of hemoglobin we have from both our parents. There are a number of hemoglobin types usually known only by a letter of the alphabet. So the most common type are called normal hemoglobin and sickle cell hemoglobin. If someone inherits sickle cell hemoglobin from both parents, he or she will have sickle cell anemia. Sickle cell anemia occurs when most of the hemoglobin inherited in sickle hemoglobin because it causes the red blood cells, which are normally round and pliable, to become rigid and cycle when they give up the oxygen they are carrying. So let me say this, if someone inherited sickle cell hemoglobin from only one parent and a normal hemoglobin from the other, he or she will have the sickle cell trait. The sickle cell trait is not an illness and cannot change to sickle cell anemia. So what are we supposed to know here? When both parents have sickle cell trait, each of the children has 1 in 4, that is 25% chance of being born with sickle cell anemia. In sickle cell anemia, a 1 in 2, that is 50% chance of being born with sickle cell trait, and a 1 in 4, which is 25% chance of having a normal hemoglobin. So, how does sickle cell anemia affect a person? The following conditions are quite common in people who have sickle cell anemia. One, we have pain. I'm going to explain all these. Pain, this occurs unpredictably in any body organ or joint. When the sickle cell shape cell gets stuck in the small blood vessels, thus preventing normal blood flow, the blockage causes severe pain in the arms, legs, back, and stomach. They may also lead to stiff and painful joints and swelling of the hands and feet. Pains, pain is the principal symptom of sickle cell anemia in both children and adults. Infections. Serious bacterial infections are a major cause of morbidity and mortality in patients with sickle cell anemia. And then we have anemia, fatigue, paleness, and shortness of breath are all symptoms of anemia. Anemia is a shortage of red blood cells. Jaundice, this is a yellow coloration of the whites of the eyes. So when the eyes change color, it results from the rapid breakdown of red blood cells. It should not be a cause of concern unless it becomes noticeably worse. We have stroke. The defective hemoglobin damages the walls of the red blood cells, causing them to stick to blood vessels walls. This can result in the development of narrowed or blocked small blood vessels in the brain, causing a serious life-threatening stroke. This type of stroke occurs primarily in children. Number 6, we have acute chest syndrome, a life-threatening condition of sickle cell anemia, similar to pneumonia that is caused by infection or rapid sickle cell in the lung. This is characterized by chest pain, fever, and abdominal chest x-ray. These conditions are called crises. Crisis. Some having a crisis will suddenly become unwell or complain of severe abdominal or chest pain, headache, neck stiffness, or drowsiness. Something you are supposed to note is that someone having a sickle cell crisis needs an urgent hospital treatment. And crisis usually starts from the age of about 4 months. Some people get crisis quite often, others may get them only once every few years. In between crises, the person is well. Sickle cell anemia will not affect a person's intelligence, and therefore, children with sickle cell anemia can attend school and participate fully in normal school activities. In whom is sickle cell anemia most common? Sickle cell is most common in people of Africa or West India. This is when, or we may call it like the Caribbean descent, but it may also occur in people from India, Pakistan, the Middle East, or the Eastern Mediterranean. This may be because the sickle cell trait gives some protection against malaria. This is not the case for people with sickle cell anemia who must receive the recommended antimalarial when visiting the malaria zone. Living positively with sickle cell anemia. Understanding more about the sickle cell anemia is a first step towards an improved quality of life. There are several practical steps you can take to help reduce the frequency and severity of sickle cell crisis. Drinking plenty of fluids. So when you drink a lot of fluids, that is watery foods, water is essential for the body. People with sickle cell anemia should drink fluids as often as possible. They should avoid becoming dehydrated. This extra fluid intake in children can lead to frequent visits to the toilet. This problem may also cause bedwetting until the child becomes a teenager. However, the amount of fluid intake should not be restricted. Instead, a decision of the problem with the child's doctor, a social worker, or a sickle cell counselor should help you to manage it well. Keeping warm and dry. Sickle cell anemia may get worse in cold and wet situations. Make sure a child with sickle cell anemia is always warm and dry. Warm clothing should be worn in cold weather. Sudden changes of temperature must be avoided. Cross country, running, and strenuous outdoor activities should be avoided in cold or wet weather. A child with sickle cell anemia should only swim if the water is warm and care is taken to keep warm when leaving the water. If Sorry. If the child develops a crisis despite these precautions, he or she should avoid swimming together. So, whenever you should encourage the child to join in with as excess as possible, make sure the child with sickle cell anemia does not become too tired. Encourage him or her to rest whenever he or she feels tired. We have regular visit to your doctor or hospital clinic. Make sure the child with sickle cell anemia visits the person who is helping her or the hospital clinic regularly. There will be blood test, physical examination, and the opportunity to ask questions and to discuss the condition. Take any prescribed medication at the right time and dosage, and always keep your hospital and clinic appointments. When you travel, make sure the child with sickle cell anemia is adequately prepared for travel. If he or she is going on a plane journey, ask for advice on precautions to take before or during the flight. For instance, increasing fluid intake, having painkillers in case he or she should develop a crisis, and the ability to access oxygen should this be necessary. Airline cabin staff must be aware of these special needs. This must be brought to the attention of the airline at least a week prior to departure so they can arrange suitable staffing. We have malaria prevention. Ensure anti-malarial protection is given when living in or visiting a malaria zone. Allow plenty of time to obtain a prescription and to start the treatment period to the holiday, about 2 whole weeks. Medication to prevent other infection, we have penicillin, that is one. It is recommended that children with sickle cell anemia take penicillin twice a day, every day. This should be started as soon as the diagnosis of sickle cell anemia is made, preferably at 2 or 3 months of age. This helps to protect them against pneumococcal infections, and prescriptions can be obtained upon visiting your doctor or clinic. Children who are allergic to penicillin can be given antiritmicin in appropriate doses. Another one, we have vaccination. Children with sickle cell anemia have a normal antibody response to vaccines and should receive all immunizations recommended by the KP. Furthermore, children with sickle cell anemia should receive the pneumococcal vaccine. This is given from 2 years of age and then a booster every 5 years. Your doctor may recommend other vaccines depending on the situation. The third one, we have folic acid. Folic acid taken as the doctor or clinician advice helps treat to prevent anemia. So we have another one, which is finding and giving support. When we talk about finding and giving support, if it is sometimes difficult to come to it, like, how can I put this one? Like, it is sometimes difficult to come to terms with a chronic condition like sickle cell anemia. Sometimes it is hard to talk about it for fear of stigma. However, it is known that sickle cell anemia, just like any other chronic medication condition like diabetes and asthma, should not prevent you from leading the quality life. So, as well as receiving help and advice, sharing experiences and meeting others with sickle cell anemia can be beneficial to the child and the parents alike. Both parents and older children should enroll with a psychosocial support group if available. The child with sickle cell anemia may sometimes feel unable to cope up with inconvenience and painful effects of the conditions. You can help by being aware of his or her feelings and al- by making allowances when necessary. Make sure that you and the whole family are aware informed about sickle cell anemia. New doctor and dentist must be told before any treatment is prescribed. Last but not least, parents, doctors, teachers, and sickle cell support groups should work together to help the child with sickle cell anemia and lead a full and normal life. And what should I do? What should I do now that I have sickle cell anemia? We talked about travel, and I say that when traveling, it is important to see the doctor for adequate preparation for travel, especially when traveling to malaria zone areas or high altitude areas. Another thing that you're supposed to do is take special care of injuries. Never apply a cold pack to an injury or pain site if the child with sickle cell disease is injured during the school day. However, other first aid measures are safe for children with sickle cell disease who are injured at school. First aid measures that should be provided when necessary include applying direct pressure and for bleeding, wrapping, wrapping with, wrapping with an ache bandage, or elevating a heart limp. And watch for signs of stroke. This is what you should do. You should watch for signs of stroke. Some children living with sickle cell disease may have learning difficulties due to health problems associated with stroke, that is blockage of blood vessels in the brain that then cause brain damage. Teachers should be aware that declines in academic achievements, inability to maintain attention, difficulties with organization, and mild delays in vocabulary development may be due to small brain injuries caused by stroke. Change in handwriting from legible to illegible can also be a sign of stroke in children. Teachers should contact parents when change in learning or a child's attentiveness are detected so that the child's doctor can be notified. Formal, nego- Formal neurocognitive and educational testing may be necessary to determine any learning difficulties caused by stroke. The testing may help school personnel in developing the best teaching strategies for the student. And at the same time, on medication, I talked about penicillin. So I want to talk about folic acid. This is another medication taken as the doctor or clinician advice. It helps to prevent anemia. We have zinc. When taken, zinc helps with regulating immune function, treating diarrhea, effects on learning and memory, treat the common cold, wound healing, decreased risk of age-related chronic diseases. We have hydroxyurea. This is another medication taken to increase fetal hemoglobin, which increases the red cells in the body and reduces crisis episodes. And I talked about vaccination. Let me just repeat it. People living with sickle cell anemia have a normal antibody response to vaccines and should receive all immunization recommended by KEPI, that is Kenya Extended Program of Immunization. Furthermore, people living with sickle cell anemia should receive extra vaccines like pneumococcal vaccine meningococcal vaccine, typhoid vaccine, and any that may be recommended by the doctor depending on the situation. So, finding and giving support. This is when you want to give support to these people with sickle cell anemia. It is sometimes difficult to come to terms with chronic conditions like sickle cell anemia. Sometimes it's hard to talk about it for fear of stigma. Receiving help and advice, sharing experience, and meeting others with sickle cell anemia can be beneficial to the child and the parents alike. Sickle cell, like any other chronic medication condition, should not prevent one from living or leading quality life. Both parents and older children should enroll with sickle cell support groups. People living with sickle cell anemia may sometimes feel unable to cope up with the inconvenience and painful effects of the condition. You can help by being aware of his or her feeling by making allowances when necessary. Always make sure that you and the whole family are well informed about sickle cell anemia. New doctors and dentists must be told before any treatment is prescribed. Before aware of emotional well-being, not all children with sickle cell disease have outward signs of illness. However, children with sickle cell disease may be smaller in size, have delayed puberty to experience judens. Judens is yellowing in the skin and eyes. These sometimes subtle outward signs may make children living with sickle cell disease target for teasing and bullying. Students with sickle cell disease may cope with their differences by being aggressive, isolating themselves, or avoiding social situations with peers. Like other children with medical challenges, children with sickle cell disease may not have as many opportunities to play with other children. Thus, thus recreational activities or group based. So this is what I want to say as we finish. When to treat as an emergency, pain or discomfort. This is the sign and symptoms, that is severe headache. These are now the descriptions. So the sign or symptom is pain or discomfort. Description is severe headache, chest pain, bone joint hip pain, upper left abdominal pain or spleen. We have prepism, that is painful erection. Treat as emergency when you see this. Another sign and symptom is paleness, change in the skin color, lips, and fingernails. We have fever when there is fever, that is description. Weakness or fatigue. Weakness on either side of the body, that is possibly stroke. Inability to speak, possibly stroke. Difficulty with memory, that is possibly stroke. Sudden or constant dizziness, possibly that is stroke. And we have blurred vision, vomiting more than once. Another one is changing in breathing, difficulty in breathing, fast rate breathing, and harsh, noisy breathing. And we have swelling, hands, feet, joints with redness. So those are when you are supposed to be treated as an emergency. Does sickle cell have a cure? Bone marrow and stem implant are the only confirmed cure for sickle cell diseases. So bone marrow and stem implant are the only confirmed cure for sickle cell disease. Transplants are usually done in children under age of 16. However, hard sickle cell complications like pain and stroke, your child first gets strong chemotherapy drugs to destroy her bone marrow and damage red blood cells before bone marrow is recommended. One has to go a series of tests want us to go a series of tests to qualify for this transplant. So that's all about sickle cell anemia. And sickle cell anemia is a chronic disease. And as I said, sickle cell disease is a genetic blood disorder. It is most common among people whose ancestors come from Africa, the Middle East, the Mediterranean basin, and India. It affects hemoglobin. Hemoglobin is the protein found in the red blood cells and thus helps to carry oxygen throughout the body. And two genes for the sickle cell hemoglobin must be inherited from one's parent in order to have the sickle cell disease. But mostly sickle cell is if it's mostly found in children. I really want to appreciate you for your time and take a lot of time to share this information about sickle cell. It will help so many people. Thank you and be blessed abundantly. Ensure that you share, you like, you comment, and finally you subscribe to this channel. Thank you. Bye bye.